Today our topic is blood vessels. So as you know, so heart it is a pumping organ. It can pump the blood or it can supply the blood throughout the body. So with the help of certain channels, okay, are certain pipes. So those are nothing but they are the blood vessels. So blood vessels, so they acts as the channels or passages or canals for flow of the blood along with the nutritions, enzyme, certain essential substances and as well as the waste material. That is one of the important functions of blood vessels is so they are acts as a channels or passages for to allow the flow of the body fluids along with various materials. And blood vessels is also helpful for the communications because it allow the flow of blood means so with the help of the blood or components of the blood the organ can be communicate. So that's why the blood vessels are also directly or indirectly it was play important role in the to create the communication between the different organs. Okay, so first one regarding the blood vessels. So blood vessels are the channels through which the blood can distributed throughout the body. So these are made up of the muscles. So these are made up of the tissues. So they are acts as the passages or channels through which only the blood can be flow from one place to the another place when the heart can create the pressure on the blood. And the blood vessels, so they are near to the heart or their beginning site is near to the head and end toward the heart only. It means the blood vessel they are start from the heart and end at the heart itself. That is the origins of the blood vessel. First, that is the aorta. So aorta is the big artery. Okay, so it is the beginning of the blood vessels. Then that aorta is converted into various arteries, then arterioles, then followed by capillaries, then veins, then vanules, then finally the vanules which can reaches to the or end to the head. That is the superior vena cava and inferior vena cava. So these are the larger vanules or vein. So their end is only at the heart. So that's why the blood vessel they are beginning from the heart and as well as so they are end at the heart. For here it is this flow chart it can explain that is the regarding the artery. So arteries so their origins they are begin from the heart, then they carries the oxygenated blood along with the nutrition so that gets transported to the arterioles. So arterioles are the branches of the arteries. So their function, their features, so they were also similar to the artery, but so they are branches, they are origin from the artery. Then each arterioles so they are different branch or differentiated into different small blood vessels or that is capillary vasculatures. So those are known as the capillaries. So capillaries, so these are originated or begins from or these are the branches of the arterioles, and these capillaries always present near to the tissues. Okay, tissues are nothing but so they are made up of the cells. Okay, tissues are group of cells and those cells so they require continuously oxygen, continuously nutritions, okay, are continuous substances for to regulate the metabolic functions of its origin. So where they are present. So that's why the capillaries is always present near to the metabolic cells. Okay, if any organ it is less metabolically active, it means it will be having the less capillaries. If any organ it will be highly metabolic or simply highly active, so that organ will be having the rich of capillaries. For good example, that is our liver. Liver is a highly vascularized organs or highly a metabolic organ or metabolic active. So that's why the liver will be having the rich of capillaries, like that our brains. Brain is also highly vascularized organs, highly active. It was regulate all functions of body. So that's why the capillaries in the brain was rich in numbers to get to gather immediately to the oxygenated blood along with the nutrition. So that's why the capillaries is always present near the tissues. So they are origins from the arterioles. Okay, so then from the capillaries, so then they are responsible for the formations of the vanules. Then as well as further the vanules are grouped together, they are formed the larger vein. So those are known as the veins, that is supravena cava and supravena. So like that the blood vessels, so they are origin from the artery and ended towards the only origin from the heart and end towards the heart itself. So regarding on the basis of their structure and function, the blood vessels are mainly classified into 5 types. One is the arteries. So these are larger in shape. So they are carries the oxygenated blood. It is also made up of the 3 layers. Okay, arteries. So these are regarding the structural classification. It is made up of the 3 layers. Okay, and its function, it always carries the oxygenated blood, or it carries the blood away from the heart. So those are blood vessels. So they carries the blood away from the heart, and those are known as the arteries or arterioles. Okay, so then these arteries, so they are branched together into small blood vessels. Okay, so those are known as the arterioles. Regarding the structure and features, the arterial structure is similar to the arteries, but regarding the size, so they are smaller than the arteries. But regarding function, so these are also transported the oxygenated blood. So next one is the capillaries. So these capillaries, so they carries the blood away from the heart, as well as they supply the blood towards the heart. It is having the dual functions. It is involved in to supply the that is the oxygenated blood, as well as to removal of the deoxygenated blood. That is the dual functions of the capillaries. And capillaries, so they are always present near to the heart. These are a single layer. They are look like a mesh. So due to mesh in vasculature in nature, so they easily give the nutrition along with oxygen to the cells, and as well as it can gain the waste material or carbon dioxide from the cells. So that's why the capillaries, regarding the function, it was involved in the transportation of both type of the blood, that is the deoxygenated as well as the oxygenated. So these are the smaller in diameters or size. So these are origin from the arteries and enters into the vanules. Okay, so next after that the capillaries, their size can be enlarged, slightly increases, and those are known as the vanules. Okay, so vanule structure, they are similar to the arteries. Okay, they are also made up of the 3 layers, but function is, so they are transported the deoxygenated blood, or they carry the blood towards the heart along with the waste material and carbon dioxide. That is the functions of the vanules. And these vanules, so they are merged together in a single blood vessel that was known as the vein. So group of vanules, they branch together. Okay, so they are unique together, branch together. So they are responsible for the formations of the another blood vessel that was known as the vein. So the vein, so they are larger than the vanules. And regarding the features and structure, the structures of the veins are the layers of the vein. So they are similar to the arteries. It means it is also made up of the 3 layer. It is also surrounded by a 3 layer, but function is it can carry the deoxygenated blood, and arteries after they carries the oxygenated blood. So like that, so what are blood vessels? So they are present in our body. So they are mainly classified into 5 types on the basis of structure and on the basis of the functions, like arteries, arterioles, capillaries, veins, and as well as the vanules. So next one is the, so regarding the arteries, so dear students, the arteries always carries the oxygenated blood or from the heart, okay, towards the different parts of the body. And arteries always, they can supply the or transport the oxygenated blood except pulmonary arteries. So this is the only one optional is there in our body. So where the arteries can transported the deoxygenated blood. So those are pulmonary arteries. But remaining, whenever you are seeing the name end with arteries, so they always transported the oxygenated blood, and they always carries the blood away from the heart. But regarding the pulmonary arteries, so these are only arteries in our body, so they can carry the deoxygenated blood. So here the pulmonary arteries, so they carries the deoxygenated blood from right ventricle to the lungs for the oxygenation process. But remaining arteries, so they always consist of the oxygenated blood. And arteries always present deeper to the skin. Okay, so they are present deeper. Okay, easily they do not, we can relocate. So they are deeper to skin, and so they will be always carries the oxygen blood. And these arteries, so they are made up of the 3 layers. Okay, so the outermost layer, that was known as the tunica externa, or also known as the tunica adventitia, and the mid layer, that was known as tunica media, and innermost layer, okay, inner layer, that was known as the tunica intima or tunica interna. So dear students, so this tunica intima or tunica interna, so this is the first layer of the blood vessel or innermost layer of the blood vessels, and it is made up of the simple schymous epithelial tissue along with the connective tissue. So they are present on the basement membranes. So basement membranes is nothing but it is made up of the certain collagens, it is made up of the certain fats, okay, or certain lipids. So this intima, it can lined with the certain basement membrane, and it consists of, or it is made up of the simple schymous epithelial tissue along with the connective tissues, and present on a basement membrane along with, so they are consist of the elastic fibers. So these are elastic in nature according to the content, that is according to the volume of blood or pressure on the blood, the diameters of the blood vessels can be adjusted due to elastic in nature, due to consist of elastic fiber, either their size is increases or either their diameter was decreases. If the blood pressure is more, means automatically, so due to elastic fibers presence in their walls of the blood vessel, their size can be increases. Like that, it can responsible for to decrease the blood pressure that was harmful to the neighboring organ. Otherwise, if this nature is not present, mean that pressurized blood can reaches to the organ, then initially organ can be swelling out, later on, so they becomes the malfunctions due to hypertrophy. Okay, so it means, so as the blood pressure increases more than the normal, then the person was suffering from the swelling of the organs, that was known as hypertrophy of liver, hypertrophy of kidney, and hypertrophy of the many other organs. And especially, so even the heart, especially, so those organs are highly vascularized. It means, so those organs, so they are required the more blood per minute. Okay, for example, liver, it is required around 900 to 1100 ml of blood per minute. And regarding brain, it will be required 1800 ml of blood per minute. And after liver, kidney, highly it can require the blood around 900 ml per minute. Okay, after that many organs are there, so they are required high blood circulations within minute. So such organs are known as the highly vascularized organs. Okay, you should be keeping this mind, this in this mind, because so those organs, so they require more blood per minute. Such organs are known as the highly vascularized organs. Among the first organ is the brain. It was required around 1.8 liter per minute. Per minute, our cardiac output is 5 liters. Our heart can pump the blood throughout the body. That the rate is 5 liters per minute. Okay, there is the annual average. Okay, among 5 liter of the cardiac output, our brain itself, it was required 1.8 liter per minute. Okay, so that supply blood to the brain, that was mainly depending upon the blood pressure. If it is decreases, supply decreases. Okay, so then the brain was suffering from the malfunctions. Okay, so that's why the brain is known as the highly vascularized organ. So after the brain, that is the liver. It required around 1100 ml per minute. Then kidney, then that is your lungs. So these are highly vascularized organs, so they required more and more blood. And less means there is a leg muscles or muscles, so they require the less blood supply per minute. So that's why if the blood pressure increases means the blood vessels can be swelling out. Okay, so that swelling of blood vessel responsible for swelling of organ, and that condition was known as the hypertrophy. Maybe hypertrophy of heart, it means heart can be swell. Maybe hypertrophy of liver, it means the liver can swell. Maybe hypertrophy of that was kidney, the kidney can be swell. You should be kept in your mind, because those people having the high blood pressure, it is uncontrolled, then you can go for the diagnosis of conditions of organ. Not only you can diagnosis regarding the blood pressure, you can also monitor the conditions of organ regarding what is the conditions of heart, what is the conditions of kidney, and what is the conditions of liver, because the high blood pressure was responsible for the cause of the hypertrophy. So that's why keep in your mind during the diagnosis. Okay, if any person having the that is a severe hypertension or blood pressure, if it is more than that is 180 mmHg, so that condition was known as severe hypertension, where the organs can be swell out. So then your work is you give the medication so that can lower the blood pressure, along with you can put the drug, so that drug can treat the hypertrophy also. Okay, in the both type of drug required to add in the prescription. So that's how you can concentrate. The high blood pressure was responsible to cause of the hypertrophy, and hypertrophy of organ was responsible to cause of the failure of the organ. So that you should be keep in the mind in the future. So here, so due to elastic fibers, so this tunica interna or intima, it can be increase their diameter or decrease their diameter. It is one of the beneficial effect. Okay, if it is fail means then only the blood vessels can be rupture or break out. Okay, so due to lack of elastic nature, because of elastic nature of the blood vessel is due to presence of the collagens. Okay, if it is less or if it is excess, then blood vessels can lose their elastic in nature, then easily the blood vessels can be ruptured, but cannot be happen with the artery. Even it will be having the high blood pressure due to presence of the elastic fibers are elastic in nature. Okay, and second most layer of the arteries, that is innermost, are also the mid layer, that is the tunica media. Sorry, and here the tunica intima, it was play important role in the absorptions and protection, because it is the underlying. So whatever the materials are there, they are required for the metabolic functions of blood vessel cells, then it can involve absorptions and as well as it can protect the underlying organ. And the mid layer that was known as the tunica media or mid layer, it is the only made up of the smooth muscles. Okay, tunica media, it is made up of the smooth muscle. So due to smooth muscles in nature, it is highly elastic in nature. Okay, so this tunica media, it was adjust the diameter of the lumens. Okay, it is adjust the diameters of the channels or the diameters of the lumens of the blood vessels according to the blood pressure or according to the flow of the blood, because it was made up of the primary smooth muscle. So due to smooth muscles only, it is highly elastic in nature. So due to highly elastic in nature, easily its diameter was increases or its diameter was decreases, or the lumen size or the channel size that was easily increases or easily decreases. So that's why the tunica media, it was helpful for to regulate the blood flow and blood pressure due to elastic in nature or due to adjustment of the diameters of the lumens or channels or passages. So to that natures, the tunica media, it's play important role in the regulations of the blood flow and regulations of the blood pressure, and as well as it can use the support to the blood vessels. Otherwise, increase the blood pressure and tunica media is failed to increase the diameter means then the arteries was ruptures. Okay, arteries was rupture, but that cannot happens in the healthy human beings due to presence of the tunica media. According to blood pressure, it is increases the diameter or decrease, so that can provide the support to the arteries and blood vessels, and easily it can allows the or regulate the blood flow as well as the blood pressure. So next one, that is the tunica externa. It is also known as the tunica adventitia. It is the outermost layer. Okay, it is made up of elastic and collagen fibers. Okay, so these are helpful for to protections of the blood vessels. It is mainly made up of elastic and collagen fiber. Due to that, once again, the arteries will be having elastic in nature. They are highly elastic. It is necessary for to regulate the blood pressure and blood flow by adjusting the diameters of the lumens and channels. So this is regarding the arteries. So arteries always, so they are transported the oxygenated blood except the pulmonary artery, and they are made up of the three layer. So all three layer are elastic in nature. Due to that, so they are allows the easily blood flow and regulation of blood pressure. If any loss of elastic in nature due to microbial infections or any entry of microorganisms, then the persons was suffering from the ruptures of blood vessels or internal hemorrhage or even hypertrophy of the organ. If diameter increases means automatically the blood pressure is decreases, then decreased blood pressure can reaches to the organ. If it is fail means then same blood pressure was reaches to the organ, then organ was suffering from the high blood pressure. Due to that, their blood vessel can rupture, internal hemorrhage may be occurs or hypertrophy may be occur. Due to that, that organ was fail. So next one, so regarding the capillaries. So capillaries, so these are the smallest, most numerous of blood vessels. So these capillaries, so these are always carries the blood away from the hearts, that is from the arteries and towards the heart or return to the heart to the veins. So that's why the capillaries, so they carries both type of the blood, that is the oxygenated blood as well as deoxygenated blood. So that's why the capillaries, so they carries the oxygenated blood away from the heart or from the arterioles and supply towards the heart or towards the vein regarding the deoxygenated blood. And the primary functions of capillaries is, so these are mainly involved in the exchange of material between blood and tissue cells, because so these are mainly present near to the metabolic cell. So that's why so they play important role in the transportations or exchange of the materials between the blood as well as the tissue levels. So capillary distribution are the number of capillaries in mainly depending upon the functions of the organs. If organ highly vascularized organs, or if the organ's metabolic active was high, so where the more capillaries are present. If the organ function is less, then it will be having the less capillaries. For example, skeletal muscles, liver, kidney, so they will be having the extensive network of the that is the capillaries due to high metabolic activity, because those are required the more oxygen and more nutrition, and these are made up of the single layer. So these are made up of the mesh. So due to that, they are made up of the filter. Due to that, easily blood enter outside the capillaries and enter inside that. So that's why it can allow the entry of the oxygen, carbon dioxide, subsequent nutrition between cells and the capillaries. Okay, so that is the major functions of capillaries. It is allow the to supply the oxygen to the tissue cells and gain the carbon dioxide along with the waste matter. So that's why the capillaries can carry both type of the blood, oxygenated as well as the deoxygenated blood. So next one is the veins. So veins, they always carries the deoxygenated blood, or they can supply the blood to the heart. Okay, so as the vein is going on, or they are near to the heart, so their size can be increases. Okay, so the larger veins are, that is superior vena cava, it can carries the deoxygenated blood from upper part of the body to the heart, and inferior vena cava, they can brings the deoxygenated blood from lower part of the body and abdomen legs. Okay, so regarding the structure and features, it is also made up of the three layers, that is the tunica intima, there is the innermost layer, tunica media, there is the mid layer, and tunica externa or tunica advancia. It is the outermost layer. And the blood pressure regarding inside the vein as compared to artery, it was less. So the maximum the pressure in the vein is 30 mm Sg. It cannot exceed more than 30 mm Sg. Okay, in maximum cases, in maximum book they are mentioned only the maximum is 15 mm Sg only in the inferior vena cava are those veins, so they carries the blood from the legs, and that vein will be having the high venous pressure, that is maximum in the leg vein is 15 mm Sg, because that blood can move the opposite to the gravitational force. So that's why we require heart. But whatever the veins, they carries the blood from upper part of body to the heart, they will be having the less than 7 mm Sg blood pressure in the venous, not in the arteries. So arteries always having the high blood pressure. And unlike arteries, the veins having special features. So those are known as the wall. Okay, the artery, they do not have any wall, but the vein, so they will be having the wall, and these wall, they can prevent the back entry of the blood, even the pressure will be less. Okay, the blood always move upward. Okay, so when due to any fall of blood pressure, okay, or venous pressure, so on that time the chance of the backflow of the blood that was not possible in the normal individuals or normal vein, because so these vein they having a special type of the wall. Okay, those are vein wall. So these wall, so they can prevent the backflow of the blood. So this is the features that was specially present in the only vein, it not found in the artery. So that's why in the vein, So there is no backflow is possible. Only the directions of blood in the unique direction, only one way towards the heart only. It cannot be possible for the back even. The blood pressure should be the less due to presence of the special type of the wall. Okay, if any wall, if they are malfunction, then that vein can be swell out. Okay, easily. If your father is farmer or mother is farmer or your mother is housewife, sitting the working in the single place, or they sitting in the single place, for them you can watch their leg. In the leg they will be having the swelled blood vessels. Okay, the blood vessels can be swell out. You easily can observe. So that condition was known as the varicose vein. Okay, that condition was known as the varicose vein. It occurs due to malfunctions of the wall, or the wall of the vein was fail. Due to that, the backflow of the blood is possible due to failure of the blood, that is the wall in the vein, so that blood can be deposited in the leg. Then the leg can be swelling out. Okay, due to failure of the vein wall or due to low blood pressure. If the vein pressure, if it is less than 15 mm as in the leg, then also the leg can be swelling out. For that reason, I told you already, you can wrap there is the wrappers or cloth that can treat the swell or varicose vein. Okay, you check out your parents and grandfathers. If your mother, father, if having the varicose vein means now today onwards you can give the treatment for them by massaging by pulling the blood upward. Okay, massage करके blood को upward को pull कीजिए और them to tell to them so they can sleep and the leg can be raised. अगर वो sleep करते तो leg raise होना चाहिए 45 degree पे. It can avoid the varicose veins or further development of swelling of the leg. Okay, leg ऊपर लेना चाहिए. Or you can wrap the cloth around the leg weekly once or daily 1 hours. Or also I told to you, you can use the ice. Okay, you can massage the leg with the ice. So you take the ice, okay, piece and massage on the leg. So that was caused the contraction. So due to contraction, the blood can pull the upward direction. Then they are free from the varicose. Because if the varicose vein is occur means, so that blood can deposited here for longer duration. And already you know the vein will be having the impure blood or deoxygenated blood. It consists of various of waste material, and those material can here only they can accumulated, then those are responsible to cause the damage of the healthy tissues of leg. In future the leg was fail, there is chance of varicose. Or so these vein can be brushed out due to infectious fluid. Okay, in the present in the single place infectious fluid वहाँ पे deposited होने की वजह से they consist of waste chemicals and waste material, they can damage the blood vessel, then where the leakage can be occurs in the leg. From the leg itself the blood can be leak out. Okay, leg में से blood बाहर आना start होता है. Okay, in the, so that's why you are the ideal students. You can have the responsibility to take the care of your parent. Today onwards you can check your parent legs and mother legs and father legs. Okay, in the old age it is more common. If they have a means, from here only to insist to them, so their locomotion is अगर उन्हें inactive ज़्यादा है उनको walk करने को बोलिए. ओके, ज़्यादा एक ही प्लेस में पापा बैठ के काम कर रहे, उनको एवरी 1 hour मूवमेंट करने को बोले टेबल से. ओके, इसी बहाने बाहर पानी पीने को जाना या चाय पीने को जाना ऑफिस में से, सो दैट यू कैन क्रिएट द मूवमेंट इन द लेग, देन हेल्पफुल फॉर टू अवॉइड द वेरिकोज वेन. और घर को आने के बाद यू कैन यूज द मसाज और आइसिंग, और इफ इट इज सीरियस देन यू कैन यूज द क्लॉथ. देन फर्दर you can avoid the varicose vein or swelling of the leg. Okay, so that was occurred due to failure of the vein wall or due to decrease of blood pressure or old age, or many other factors are there. Okay, so next one is the, so regarding the difference between arteries and vein. Okay, arteries always carries the blood from heart towards the different part of the body, and veins, so they can bring out the blood from different parts of the body towards the heart. This is the first difference. Arteries, they carry the blood away from the heart, and veins, they carry the blood towards the heart. Then second, the arteries, they are present deeper to the skin. Okay, but the veins, so they are present superficially. So what the blood you can observe in your body, so those are the veins. Okay, because artery, so they are deeply present. Okay, next one, that is the wall of arteries, so they are thick and muscular, and the walls of vein, that was thin and non-muscular. Okay, it is one of the features of the arteries. So arteries, they having the, they are thick, they are double due to muscular, due to presence of collagen fibers. That is needed because artery having the high blood pressure. And vein, so they are the thin wall veins, and there is no that much of muscles are present, they are the non-muscular. Okay, because the vein is also having the less blood pressure, so that's why if they are thin means there is no problems. But regarding artery, if they become thin means easily the arteries can be ruptured, but that cannot be happen due to thick nature in the arteries. So arteries, so they do not have any wall, but the vein, so they will be having the wall, they can prevent the backflow of the blood. Okay, in arteries, the blood flow with the jerks. Okay, but in the vein, the blood flow can be move smoothly. But in artery, that can move with the jerks, then give some certain gaps. Okay, due to blood pressure or any other features. But in the vein, so that blood can move slowly and smoothly. Okay, the blood flow is fast in the blood arteries under the great pressure, and the blood flow in the veins, that was not fast. Okay, so because low blood pressure.